Hello and welcome to this episode of Let's Talk, where we zoom in on the practical implications and the next steps around the bigger sessions here in the Milan Congress. And in this episode, we talk about going beyond the limits of re-osseointegration. My name is Gerrit Heijkoop and I'm proud to be joined by the two chairs of this session, Katja Nelson from Germany. Katja, welcome.
Hello. I'm very happy to be here.
I'm happy to have you here together with your co-chair, Vivianne Chappuis from Switzerland. Vivianne, welcome.
Hello, thank you very much for the invitation and for having this format, Let's Talk.
Exactly. Let's dive right in and let's start with the basics. This whole third day of Congress is all about going beyond the limits. And in your case, going beyond the limits of re-osseointegration. Katja, why is it important we talk about this topic in this Congress?
Well, just while you were repeating the title, Beyond the Limits, actually we do not have a defined limit yet. So this is what we have to look at. Where is the limit? And I think our session, Vivianne, you probably agree, was you could see the spectrum is really wide and we don't have very defined factors that tell us what to do when this and this situation is there.
Exactly.
So,
and this situation, when we talk about re-osseointegration, are we talking about a failed implant to start with?
Yeah, so we saw with Frank Schwarz this severe peri-implant defect, severe destruction of the hard and soft tissues, and he showed amazing cases how he is able to regenerate it from a clinical point of view, just to stop inflammation. And I think this was very amazing to see what is actually possible. We have to be aware that this is very challenging. We have to handle the bone tissues, we have to handle the soft tissues, and we are not in a normal environment where we do surgery, so we have an infected site. So this is a very, very challenging environment.
And are we always speaking about peri-implantitis as a reason for failure, or is it a broader topic?
well, the etiology of peri-implantitis has different factors, and it's not, that this factor is the reason for the peri-implantitis. So first you have to look at what could be the reason for it. Even if now we have defined some parameters, we need enough bone surrounding the implant, we need a certain position of the implant, we need attached gingiva around the implant. So we're defining the success factors for the longevity of the implant, and still, even if you do everything right,
there is a risk of peri-implantitis submersion.
And so this is kind of driving the research, and it's driving us crazy. So first of all, we have to look at, we have these factors, and then we have to see we have different treatment approaches.
Exactly. So it's also, the starting point is not that once an implant fails because of peri-implantitis, it's situation hopeless. There is scenarios where actually re-osseointegration and a further happy and healthy life is possible.
Definitely. This is what Homley showed, that re-osseointegration is possible. This is what Frank showed. So it's not hopeless. And we will have peri-implantitis even if we do perfect implantology. We will have it. And the good thing is the patient will not die from it. And we have treatment options. And we can redo it with a high success rate.
Yeah, so that's a hopeful message here in this Congress. Was there anything that the two speakers shared that surprised you, Vivianne?
I think there is not only like the bacteria causing peri-implantitis, it's multifactorial, and that's why it's also so interesting and also so difficult to come up with certain guidelines, because we have the prosthetics. We have seen this makes it much more difficult when we cannot remove the prosthetics, but when we can remove prosthetics, Homley Wang showed beautiful regeneration possibilities. Then we always have the patient, which we really carefully have to assess. So we saw if this is a heavy smoker, the regenerative potential is really changing to a completely different direction. Or when we cannot remove the prosthesis in certain situations, it's just not possible to regenerate. And then also the patient, when he has a failed implant or a complication, he's frustrated.
That's a different attitude, right?
Yes.
I can assume,
Yes.
because you're back to the dentist, you promised me a solution last time, here I am again.
And there we need predictable solutions, and at the moment we have so many options, and it's really difficult to sort out which are really the key factors.
Yeah, and I guess in this Congress in 2024, that's where we are now.
Yeah.
It's multifactorial and we don't exactly know which button to push to make it predictable.
And I think it's also, everybody's talking about personalized medicine. It's also the patient that brings in certain factors. Now, we're trying to define factors that we can influence, but then we also have to look at the patient factor that the patient brings in. I think Homley or Frank, they both showed that smoking might add to the factor. We don't know if the patient...
Isn't smoking in general like a risk factor, or at least a contraindication for implants, or should it be, or no? But might be, maybe it should be, yeah.
Define smoking,
Yeah.
One smokes one cigarette, one smokes heavily, one gets lung cancer, one smokes heavily, doesn't have any problem with it. So again, we have the individual factor, but I think smoking is not a contraindication. I hope you agree, but this is definitely not the topic. But other individual factors, bone physiology of the patient, what he eats, if he does exercise. I think these are also factors that we will probably look at in the future, the individual factors the patient brings in.
But when I listen to that, Katja, I think it's not getting less complex.
No.
You're adding more variables to the equation.
Yes. But the more we understand, like in research, you ask one question, you answer it, and you have 5
You have
new
more
ones.
questions, yeah.
So this is a problem a researcher has.
I know. So I hear there's a bright future for science in implantology because there's so many factors to be researched. Vivian, when we look forward to this scientific future, what are you curious? What do you hope science will start with first?
Yeah, I would really love to have like a decision tree in order to help especially also young clinicians. So when they see a beginning of peri-implantitis, I think it would be really nice that we could treat these defects early on. And also the cases we saw today, they were quite late. So I think it's really important that the patients are in a maintenance care program, because these cases do not hurt. The patient doesn't come by itself. So they have to come regularly. And then when we see small changes, then we have more options.
Exactly.
And I think...
Do you feel that awareness is enough out there? Is everybody who's around implants, or even general dentists, are they aware that it's such a topic that needs to be so much taken care of?
I think so. Everybody is aware, but sometimes patients are not compliant. They just want to have a solution. And, it's not so always comfortable to go to the dentist.
Yeah.
So, I cannot blame them if someone tells me, yes, I just want to come like every second year.
Yeah, especially as you say, it doesn't hurt yet.
Yeah,
right?
Exactly.
Yeah. All right. If we look at the clinical practice, walking away from this session or watching this session in recording afterwards, what do you hope people will change?
Well, I hope that they see it's not hopeless, that we have tools we can use to treat peri-implantitis or to achieve a re-osseointegration or to stop the inflammation. I think this is pretty clear. And I think a very important point Vivian just made is that the diagnosis comes pretty late. And I think we need to work on this, and we need to focus on this, that the maintenance is important, and hopefully to get tools that make early diagnosis easy.
What type of tools are you thinking of?
Biological parameters, maybe, right now we're using the probe, we're using the X-ray, and I can see sometimes it's really hard to probe the implants and to define, how deep is the pocket. And every time I have to make an X-ray to confirm I have bone loss. And so this is not, putting the diagnosis peri-implantitis is not always so clear either. So I think this would be a good point to start at.
I can imagine, especially since it's a progressive disease that starts slow, right? And in the first X-rays, you won't see anything yet.
Yeah. And then, but it's already there and you don't notice it. You don't have very, very precise tools.
Exactly.
So that's a very good point.
So it seems you're asking for some kind of scientific breakthrough that we either do with a biological parameter or indicator or something we don't know yet. Yeah.
Or also that we could profile the patient, that we know this profile has probably a higher risk due to these and these factors, and then we maybe can have him in a shorter maintenance care program, and whereas the other ones we can have on a different on a different track. So this would be helpful.
Yeah, so also in the maintenance program that you do some more personalization based on specific evidence-based risk factors. Say, tick, 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 tick. You are code orange. You come in a little bit more often. Sounds like a very practical implication. To wrap up, what is holding people back to actually start doing this?
Research. It takes time. It takes resources. To answer one question, or we saw all these young people presenting their posters and the research work, some of them worked to answer one question for 1 or 2 years. So I think we achieved a lot, and implant dentistry has evolved tremendously, and we answered so many questions that we had within the last 10, 20 years that, the 40 years before weren't even asked.
Yeah.
So I think...
So you say, let's just ride the wave of time and have all this body of knowledge expand year by year?
And it is. And meetings like this, where people get together and share their knowledge and combine their expertise, that's what we should do.
Exactly. Be sure you be present at the next EAO Congress. Exact. Vivianne, final word for you?
Yes, I completely agree with Katja. Actually, the more we understand, the less we know. And the challenge is that this is multifactorial. Each individual patient is different, each defect is different, each implant is different. We have so many implant brands, so it is not so easy just to come up with one recipe. We probably will have, 20 different recipes or even more for each individual site.
Yeah.
So I think this is really the challenge, and that we can assess this in a standardized way to come up with a good evidence-based research. Is not so easy to do this very, very standardized.
Exactly.
Scientific.
So if you are watching this right now, you must be curious to learn more about this session. Thank you, Katja. Thank you, Vivianne, for sharing. And if you want to check out what Homlei Wang and Frank Schwartz had to share on stage, go watch the full recording. And you are now already living up to that wish from Katja. You are educating yourself based on science. So I hope you consume the full Milan online library that we have for you, and you'll be present at one of the next EAO Congresses.